Hello and welcome to the next version of the Meet the Greek podcast here at the Hutch Cancer Center. I'm Petros Grivas. I'm a medical oncologist here in Hutch and University of Washington School of Medicine. I'm very excited to host another great colleague and friend, Dr. Vidhya Nair, who is an assistant professor here at Hutch Cancer Center in the University of Washington. She has a focus on breast cancer. She's doing great work, and we're very excited to discuss about breast cancer today. Vidhya, welcome.
Thank you, Petros, and thanks for having me. I'm excited to be here.
Absolutely. And I can see you wear blue and white. These are Greek colors. I feel very honored.
Yes, I'm continuing the theme of Meet the Greek.
There you go. You do a great job already before even I ask you the first question. Vidya, thanks joining today. I think it's great to have you here. And I want to hear more about you and your journey so far in life. How did you end up here in Seattle?
Yeah, so before moving to Seattle, I was doing my fellowship in medical oncology at the fellowship program through Michigan State University. And then after as I was applying for jobs, I was interviewing at various places. And when I came to interview at Hutch, that was actually my first time coming to Seattle. And I thought, wow, Seattle's a great city. And then I also was super impressed by the breast program here and by the institution. And when I received the official offer to come, I was so honored to be part of such a great place that's doing such amazing research. And so that's how I started my journey here.
That's fantastic. We're so glad you came here to the Emerald City, as we call Seattle. It's exciting. And, I can tell you, looking at the mountains and the views and the water is a beautiful place for sure. So I know you're doing great work in breast cancer. Tell us a little bit, about where we stand today in terms of breast cancer research. There's so much going on. It's hard to cover it in the podcast, but just, a few broad strokes, for the audience discussing the current state and the future state in general terms.
I think that what's amazing that we've seen across all disciplines in oncology and particularly in breast cancer is that our therapies are so effective and providing such benefit to our patients. So even patients with advanced disease are living for many years, and we have so many different therapy options to offer them. And I also think one of the other amazing things that we're starting to see in breast cancer is more of a de-escalation strategy, so that how can we offer the same benefits in terms of longevity and survival and their breast cancer outcomes without giving them some of the harmful, toxic effects from our treatments. And so I think that's also a really great initiative we've seen in breast cancer, because sometimes less is more. And so I think that's an exciting place to be in our field.
Absolutely. And I think, to your point, it's always a question how you need escalation of therapy in some patients, de-escalation in others, and that personalized approach in patient care. On that theme, let me ask you a little bit more about personalized therapy approach and how does the system work here at Hutch in terms of personalized management strategies and multidisciplinary care?
Yeah, I think that one of the great assets we have in our program is our multidisciplinary clinic. It's called our ECSC, where our new patients with a brand new breast cancer diagnosis come in and they meet not only they meet us for the medical oncologist, but they also meet their surgeon and a radiation oncologist. We all meet as a group prior to seeing the patients and discuss, all the significant diagnostic testing that was done prior to that visit. And then we meet them individually and kind of give them a comprehensive plan in terms of how to move forward. I also think that our integration with clinical trials also really helps us generate a personalized approach for our patients, because we do have so many different trials available. And I think that for the right patient, that it can really meet their needs in terms of what they would like from their care.
Absolutely. And I think you're right. The personalized approach is critical and, synthesizing the data out there, how these data sets apply to the individual patient. That's the art of medicine. And the breast cancer program is fantastic here. We have great colleagues in your team. Talking about clinical trials, Vidya, can you tell us a little bit more about trials you are involved with and trials that you're excited about?
Yes, yeah. I think that some of the, just speaking to kind of the de-escalation trials that we have available there, through our cooperative groups, I think that the main ones that highlight is the Scarlet trial as well as our Offset trial. Both of those are de-escalation studies, one in triple negative patients and the other in premenopausal hormone receptor positive patients. So that's really, those are some really great trials that we have to offer. We also have another trial that I think would be particularly interesting for some of our patients that I'm involved in as a co-investigator, and that's called the MIND study. And so the primary investigator is actually Dr. Heather Greenlee, who is leading our integrative medicine department. And this is an intervention that's actually completely virtual mindfulness intervention on healthy eating and dietary habits. So I think that that is always a question I think that comes up for our patients, is what kind of diet should I be following? How do I adjust my lifestyle? And so I think this would really provide a lot of guidance for some patients. And because I think the fact that it's fully virtual, it's very accessible.
I appreciate what you're saying, Vidya, because many patients ask us about diet and nutrition and optimization. I think having this nutritional support, and as you mentioned, Heather Greenlee is great, leading our integrative medicine team. I plan to invite her in the podcast as well and talk about all the amazing things she's leading. And the other, questions in my mind is, patients go through a lot, right? Emotional distress, a lot of information coming to them. Tell us a little bit more about the program. We have social workers, we have financial counseling, we have genetics, of course, which is another major point. Palliative care. All those teams come together.
Yes, I think our supportive care services are extremely resourceful for our patients. I think that just from the start, having it, once patients receive a cancer diagnosis, they need significant support from social workers, from nutritionists, integrative medicine. There's so many different things that I think that that the Hutch offers for our patients that can be really beneficial. I think another service that patients often find very helpful is our survivorship clinic as well. I think that that's a really great place for people once they're not even once they're done with active treatment. Sometimes patients just need that extra support even during active treatments, but particularly for when they're done with active treatment, is and how do they continue to address the needs that come after, whether it's receiving chemotherapy or after their surgery, and how to cope with some of the long-term effects, whether that's needing more support from social services, from sexual health, from rehab. Those are all the things that we try to address in our survivorship clinic. And then I also think that as part of one of the Fred Hutch's initiatives in terms of developing survivorship across all disciplines is something that is a really exciting initiative that we're seeing, and something that I am very closely involved in, as I'm now the medical director for adult survivorship. And so part of my role is to really help develop more structured care for our patients who are no longer in active treatment, and how do we really help them with that transition from being seen regularly during treatment to then following up to managing their fear of recurrence and other types of symptoms they may have following their diagnosis, and then eventually helping to transition them out to their primary care provider. So that's, I think, one of the things that will be really exciting to see how we start to develop that across, multiple disease groups in our solid tumors.
That's such a great initiative, Vidya. Thank you for leading that. And I think we need that survivorship program for multiple reasons. You outlined so many of them. And I think patients appreciate that, care that, bridges, between the oncology and primary care to a degree. And there's so many aspects of care that you touched upon: emotional, social, psychological, physical, mental, and of course, symptom management, so on and so forth, sexual health, and other functions of life. So thank you for leading that. I think we're very excited to have you in that role here at Fairhat. And I think the patients appreciate that initiative. Tell us a little bit more, Vidya, about genetics. I know, breast cancer has, multiple causes, of course, can be a risk factor, but genetics in particular is something that we're learning more and more in the last several years.
Yes, definitely. I think that's something that we, as an oncology discipline, we need to be all kind of aware of what the indications are for genetic testing. I think we also are starting to see across disease groups, particularly in breast cancer, younger and younger patients, and recognizing the importance of genetic testing for those patients. I think that through our genetic counselors are excellent in terms of helping to counsel our patients that do carry our high risk mutations. We also have a high risk clinic as well for patients who don't have a cancer diagnosis but harbor the a high risk cancer mutation, such as the BRCA1 or 2 mutations, and really help to guide them in terms of what kind of cancer, high risk cancer screening that they would qualify for, and help to support them even with their family members and things like that.
Absolutely. And I think the positive impact from the knowledge generated for the patient themselves, for treatment purpose, but also the family, right? For prevention across cancer types, for both men and women in the family. It's very important, the broader family. And talking about men and women, one question that comes up is breast cancer does not affect only women. It's much more common in women, obviously, but can affect men as well.
Correct. Yes. And that is also a indication for doing genetic testing too. Whenever we see a breast cancer diagnosis in a male patient, that is an area that I think needs more, not only research, but also an area that I think we could have advocacy in terms of educating our providers about is recognizing signs and symptoms for detecting male breast cancer, because it is not as common, but when it does present, it should be quickly recognized.
Absolutely. It's definitely a flag, for germline genetic testing. And of course, specialized team for optimal care. Switching gears, Vidya, going back a little bit to clinical trials, I know that we have the ESMO meeting these days. We have multiple things going on. Any major data sets that you're excited about, in the field of breast cancer? A great leader, Dr. Sarah Hurwitz, our division chief for hematology oncology here for Hutch and UW. She's actually the discussant in one of the late-breaking abstracts at ESMO. We'll have to see the data, of course, but that's extremely exciting.
Yes, yeah, I think that is very exciting that we have our very own Dr. Hurwitz going to present. With that, I think the Victoria 1 study is something that is particularly exciting in terms of the updated results, which we had the opportunity to participate from the early phases of that study, and we'll be continuing as a site for their later stages of that study as well. So I think it's really exciting when you've had such involvement in some of these studies, and our patients, I think, also like to be aware of when those results get publicized and available for the greater community. And it really, I think, helps give them a sense of purpose to what they're doing and what they're really helping with in terms of evolving the science.
For sure, absolutely. And it's great to see our group here being involved and leading many of those trials. Some of them can be practice changing, applicable to patient care, and others also, give access to innovative therapies, as you said. So when you see a patient in clinic, Vidya, how do you approach the concept of clinical trials? How do you discuss with the patient, in a brief summary?
I think that every time we're seeing a patient, I think clinical trials is always on our mind. That's one of the great things that we have to offer at being at the Hutch, is the access to that. So I would say every time I see a new patient, I'm always thinking about clinical trials. Every time I'm seeing a patient as a second opinion, I think that's one of the big reasons we see patients, from the community, is because patients have an interest to see what other novel options that we may have to offer that they wouldn't have access to at their local oncologist. And then even with our other follow-up patients, I think that it's always important when we have actually some studies looking at patients who, for our hormone receptor positive patients, we know that there are that subset of patients who have that higher risk of recurrence much later on in their course, 10, 15 years after they've completed their adjuvant therapies even. And so how do we identify those patients who are at risk for that late recurrence? And so we have a few studies that are actually evaluating those patients who have are at least 2 to 5 years within completion of their endocrine therapy. And if they're considered high risk, what other potential kind of escalation therapies that we could offer them. And I think those are really important because I think that's also an unmet need in breast oncology is how to identify those patients and what kinds of therapy options we can provide for them. So whenever we're thinking about patients who, are doing really well and kind of about to transition more to that survivorship phase in their care, that's kind of a good time then to think about, okay, what are some potential trials that we could offer them in that regard?
Thank you, Vidya, for explaining that. I think it's super important for patients, for the families, for our colleagues and friends in community, who really, really want to collaborate and work together with us for patient care. Speaking about of colleagues in community, I'm always impressed how they see multiple different cancer types and keep up with all the different data sets. A couple of quick comments, Vidya, as we think about the collaboration and work with the community oncologist.
Yeah, I mean, I think that is extremely important to be engaged with our community colleagues because I think that we are able to provide input, not just from a kind of second look, but also to see, again, like what are some of the, latest published data that we may be applying, that we may not be applying. I think some of the most engaging discussions I've had with some of our community colleagues is talking about some recently presented data and asking, getting our input on like, are you guys implementing this yet? Or is this something you feel needs longer follow up? And so I think really having the forum to have those discussions is really important because I think that a lot of these decisions are very nuanced. There's no right or wrong answer. And we're really just trying to do the best for our patients and make the best clinical decisions.
Maybe the last question, Vidya, before we go, it's amazing to be here at Hutch having this scientists around us, the laboratory. Can you say a couple of words about the collaboration with people in the lab and the science being done here to help enable the clinical trials?
Yeah, I think that's something that we're extremely lucky to have that collaboration with basic science. And we have some excellent physician scientists who are also specifically doing amazing research within breast cancer. And I think that the collaboration from the lab to applying it to clinical trials, I think is also what makes our institution so innovative.
That's a great note to end there. I think, Vidya, you covered it so well. Thank you so much for what you're doing in breast cancer research, in patient care, education, medical director survivorship program. I think it's so important to have that teamwork here. And thank you so much for your time today.
Thank you, Petros. It was great to chat with you. This was a lot of fun.
I appreciate that. I welcome everybody in the audience to keep following our podcast. We're still in the beginning, but I'm so excited about talking to my colleagues and friends, learning from them every day. Thanks so much for what you're doing for patients, for research education. Have a wonderful day.
Thank you, Petros. Take care.